Good afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Tuesday, June 2nd. We are joined today by the Yukon Premier Sandy Silver and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. We also have with us Mary Thiessen, our American Sign Language translator, and Andre Bourchier from French Language Services, who will translate any questions from French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Thank you. Premier Silver?
Thank you very much, Pat. Hello again, and thank you very much for joining us here on the traditional territory of the Kwalin-Dun and the T'an-Kwachin Council. I have some brief remarks today about our government's response to the ongoing COVID-19 pandemic. We continue to support those who are impacted by COVID. Through our collective efforts and actions as Yukoners, we are able to lift restrictions and continue on our pathway forward. Last week, we were able to close the Respiratory Assessment Center. Yukoners can contact 811 if they have questions about testing or are experiencing symptoms. I want to thank everybody for their work at the Respiratory Assessment Center. Personal services are once again allowed to operate. Restaurants can open for dine-in services at 50% capacity. Recycling services are now back up and running. We continue to meet with chiefs and mayors as well as officials at First Nations and municipal governments to ensure that we and them are all aware of the challenges and that we're comfortable in moving forward and also pivoting where need be. Each community will determine what they believe will be safe for people to visit their communities. We want to make sure that communities are informed, comfortable, and safe. We also want to make sure Yukoners are informed and prepared as we ease restrictions. Recently, for example, the chief of the T'an-Kwachin, Roberta Joseph, and also Mayor Wayne Potoroka, the mayor of Dawson City, posted a message to Yukoners. It lays out how respectfully visits to the Dawson area can be done, and they're very clear in that message, and I want to thank them for that message. As campgrounds open and more people begin to move around our territory, I believe that you will be seeing this sort of information from communities and First Nations to make sure Yukoners know what's expected of them as they travel around our beautiful territory. The Territorial Parks team is already ready to go for campgrounds, ready to open on Thursday. Campers are being asked to be diligent in practicing the Safe 6 practices, the Safe 6 steps while they are camping. Staying 2 meters apart from people, not in your household bubble, and limiting your gatherings to 10 people or less. Washing your hands and regularly sanitizing the surfaces that you come in contact with, like picnic tables and common areas. Be as self-contained as possible and pre-purchase your camping permit online or at a vendor. Again, be respectful when traveling through Yukon communities and follow the wishes of those communities. I absolutely appreciate how hard Yukoners are working to keep our territory safe, so thank you very much for that. We are all learning how to live in this world where COVID-19 is a reality. This weekend, we saw an unusual occurrence that we were able to respond swiftly to following the COVID-19 guidelines. A plane traveling from Seattle to Fairbanks landed in Whitehorse due to technical difficulties. Airport and emergency staff responded, and we were able to keep the travelers safe and in isolation while they awaited a new plan to continue their trip. A big thank you to everyone who responded to this situation so professionally. It is a good reminder of the fact that life goes on, and we will continue to see emergencies that require a quick response. I think of wildland fire crews who are training and adapting to the season ahead, and I wish you all the best of a season. These crews are ready to keep Yukon safe from wildland fires and will adapt as needed be to do this important work. As part of our ongoing pathway forward, we've also been speaking with our neighbors in Alaska, for example. We recognize how much we would like to visit Alaska this summer, but now is not the time. The National Quarantine Act is still in place, and Canada's borders to the United States remain closed. I spoke with Governor of Alaska, Mike Dunleavy, just yesterday, and we are in conversation with our federal colleagues as well, but I do not see a lift to that restriction in the immediate future. We will begin with our plan to lift restrictions to BC on July 1st, and we will continue from there. As we continue to lift restrictions when it's safe to do so, we are also making sure that Yukoners receive the support that they need. One group who have been impacted by the closures of schools and services are Yukoners living with disabilities and the loved ones who support these folks. Our government recognizes the strain, both mentally, fiscally, that has been caused by the restrictions needed to keep people safe. We are making additional money available to the clients of disability services to help support people who are feeling the loss of these services. These services are typically available through schools or day programs or recreation facilities. So an additional $400 per month will be available to disability services clients, and also $250 will be available to approved home caregivers each month as well. This funding will help reduce the financial strain caused by the ongoing pandemic response. I'm very happy to be able to offer this additional support and hope that as restrictions are lifted, people are again able to access the community's services and supports that they rely on. Before I wrap up my update today, I must also take a moment to recognize the rallies and the individual actions happening across this country, the United States as well, and globally. People are raising up to make their voices heard and their actions seen in response to an ongoing racist practices that continue to plague our society. As these events unfold, we need to listen, learn, and to work to fix the discrimination that exists in our communities and in our country. I ask all Yukoners to join me in condemning racism and to stand up against it. As a white, cisgendered male, I have not been targeted because of my race or my gender. I will continue to use my privilege to stand up as an ally and to push back against racism and any form of discrimination. Part of that involves taking the time to listen to the voices who have experienced discrimination and listen to them and to hear what they have to say. It's not enough for white people to simply not be racist. We must be anti-racist. The difference seems to be subtle, but the difference lies in action. We must move from personally not being racist to actively being opposed to discrimination of all kinds. Call out racism when you see it. Do not let racists slide in comments. Racist jokes are not funny. We all must actively oppose racism. I know that we are a community that works best when we work together, and we have proven that through this COVID-19 situation. We can achieve great things by joining forces and to unite against injustices. Take some time, if you're not already doing so, to educate yourself on the issues in Canada and in our backyard, and then use your knowledge to push forward for positive change. Thank you, everybody. I'll now pass things off to Dr. Hanley. Dr. Hanley.
Thank you, Premier. Hello, bonjour. On Friday, just last week, the date for moving to Phase 2 was announced. And over the weekend since then, I've heard, again, a mix of comments. Some pleased at the opportunities to travel or to welcome, like the first sip of cool water after a long thirst, the chance to receive visitors or to restore some facet of lost business again. On the other hand, I've heard from some concerned that we're moving too fast. Why mess with a good thing? We've kept COVID out, so shouldn't we expand our social circles here while keeping the wolves outside the door? The cold reality is that we cannot live in this false bubble for long. We simply cannot sustain the human, the health, the social, and the economic costs. Each of these elements is an essential part of a healthy society. We're all hopeful for the arrival of a good vaccine or successful treatments, but we need to be able to live in the meantime for what might be a very long wait. A long wait for a vaccine to be developed, a long wait for suitable treatments to be found, and we can't continue to live in a state of lockdown. Let's look back a little bit and see where we've come in the last 2 months or so of this work. By closing borders in Yukon to all but essential travel, we have, at great cost, created a cocoon. This cocoon has given us an initial safety net, time and breathing room to get through some of our first objectives, including getting past influenza season and preventing large outbreaks. Meantime, we've learned a lot about COVID. For example, we know that in the vast majority of cases, particularly in children and younger adults, it's a mild disease. We know that severity increases with age, particularly in the presence of underlying medical conditions, and that in Canada, the vast majority of people who die from COVID are residents of long-term care. In these past 2 months, we've also had time to get to know COVID disease details better and time to learn from the world's experience. Through our own handful of cases, we've grown in our expertise in managing COVID. We've demonstrated an ability to contain COVID cases, and we've improved our ability to test for cases when needed. We've also put in place the necessary public health measures and the initial enforcement mechanisms to support these measures. We've had time to develop guidelines, PPE inventories, time to improve infection control practices, time to implement the public health measures to the extent that we have. We continue to build in more supports and measures to protect our long-term care residents, and we know more about high-risk settings for COVID spread. Meanwhile, the effects of our restrictions have not gone unnoticed. In fact, we know that now we're suffering much more from the effects of COVID restrictions than from COVID itself. To reiterate what I mentioned last Friday, we're seeing increasing mental health problems, increasing drug use and overdoses, people rightly concerned that some of our measures are impinging on civil rights, and we see business or civilians on the edge of financial ruin. We know that our reopening measures so far have met with public support and success. And as we move to planning phase 2, I appreciate that some people are concerned. I want you to know that in providing my advice to government, I am very aware of the need to balance risks. There is no easy way out. We all have to get used to COVID being around, and we all need to do our part to observe the Safe 6 measures while participating in a society that we should keep as thriving as we can manage. In the reopening plan, we identified triggers that would allow us to move from one stage to the next. Without being comfortable that these triggers are being met, then movement from one phase to another will not be advisable. We're continuing to identify and develop measures and mitigations in each of the important areas of readiness. Doing right by these measures means that we will continue to be able to address borders and self-isolation requirements, travel within Yukon, gathering size, reopening and expanding of businesses and services, sports and recreation activities, worship services, entertainment, education, and childcare. So here are a few of the areas that we have looked at or are looking at carefully. Community engagement. So we have worked, as the Premier said, with First Nations and municipal governments around public health guidelines and orders and development of next phases. And it is vital for government to continue to engage with them throughout. In our current state, most guidelines and orders are being complied with, and enforcement officers in each community are providing data back that reassures us that although there are violations and exceptions, by and large we are seeing compliance with orders and guidance. We will monitor travel within Yukon communities and monitor complaints received through the Emergency Command Centre to make sure that published guidelines are both implemented and followed. On the public health side, we remain confident in our capacity to test and contact trace under the guidance and skilled hands of Yukon Communicable Disease in partnership with community nurses throughout rural Yukon. Regardless of COVID, this is their daily work. Training and preparation for COVID response, including identification of reserve staff, has been part of their contingency planning in maintaining capacity to see us through future cases or outbreaks. As far as acute care, there are detailed plans in place that outline what the hospital's patient care capacity is, and we have identified what resources, such as beds, people, supplies, and equipment, would be required to care for patients, whether COVID or non-COVID. Additionally, we've been working together between my office, the hospital, and the department to align our plans to the health system and propose options for addressing an acute care surge should the hospital's capacity be exceeded. With an established inventory and centralized PPE distribution system, we at present enjoy an adequate supply of personal protective equipment, ventilators, ICU capacity, and staffing. Our goal over the next few months is to have on hand a 12-week supply of PPE. We monitor daily bed use at the hospital, and as services are reopened, we expect occupancy to climb back from the present levels. But should occupancy, including ICU capacity, reach levels too high for too long, this may affect our plans for transition. Looking outside, we continue to monitor the downward trends in the epidemiology of COVID-19 across Canada, focusing on our closest neighbours, BC, Alberta, and NWT. The continued downtrend in new cases, the decrease in deaths, and the increase in recoveries are positive indications that we will be able to transition to the next phase. However, if we see significant increases in these neighbouring jurisdictions, again, we will need to rethink transition into the next phase. We, of course, are using border control to manage much of our efforts so far. If we carry out our goal of opening on July 1st to BC residents, we will have in place mechanisms to verify that incoming visitors are from BC and they haven't been outside of their province in the previous 2 weeks. Additionally, we'll continue to ensure that we have self-isolation facilities for those who cannot make their own plans to self-isolate. We have no signal that disease is present in Yukon, and as a result, we were able to allow the increase of the household bubble. And while we're still limiting social gatherings to a maximum of 10 individuals in this phase, we are preparing to expand gathering sizes for phase 2. If we continue to see no community spread, we can look to increasing the number for these social gatherings. And again, we're monitoring as best as we can how people respect or continue to respect the physical distancing guidelines and the Safe 6. Restaurants, of course, are now open, albeit at no more than 50% capacity. And we must remind people that tables are to be kept to members of a household or household bubble. I've been asked many times recently about masks and what my recommendations are for public use, and how these recommendations align with other setting-specific mask guidelines. I realize these varying recommendations can be confusing, whether we look around our country or even between different settings in our own territory. I won't go into detail here, but we will put into one page or so a description of mask use recommendations and the rationale behind them, based on risk assessments and current best practices, recognizing our own situation here in Yukon. Although we don't have evidence of community transmission, we do recognize that some people will be in sustained closer contact with individuals than others, so we have suggested that masks be used in personal care services. This is a particular setting where non-healthcare workers will be literally in close face-to-face contact for sustained periods of time. Even while the risk is low, mask use is a reasonable precautionary practice. Beyond that, for public use, I support mask use as a personal decision. If a mask makes you feel safer, then by all means use one. If it doesn't contribute to your sense of well-being, well then you don't have to. We continue to follow the literature and practices elsewhere, as well as our own epidemiology. There may come a time when my advice around masks changes, but for now it is, as they say, what it is. My best advice based on my best reading of current expert advice. On that note, I'll end my update. Thank you very much. Merci, Cho. Merci, Jonathan.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll go to the phone lines now, and we'll start with Gord from Yukon News. Gord, are you with us?
No questions.
Thank you. We'll move to Tim from CKRW.
Good afternoon. My question's for Premier Silver, and probably Dr. Hanley wants to chime in on this too. Just wanted, with schooling, had the opposition put out a statement today. They had written a letter to the education minister just in regards to what the plan is for the fall. Can you, I guess, discuss what you're doing? Are you consulting with school councils? And was there any thought about, since we're in such good shape now, it's the beginning of June, was there any thought or consideration, both or from a public health standpoint, about maybe going back for the last few weeks of June?
Thanks for the question, Tim. I'll leave the substantive information to the department. I do know that we will have an update next week, and that Minister McPhee and Deputy Minister and her whole team has been actively in conversations with the educational community. But more to come on that next week in the update. In terms of this year, I think was the other part of your question, whether or not we were looking to get folks back into a classroom, I guess, is the question for this end of this year. We're not in that position to be doing that.
So I will chime in. Just to echo the Premier's comments, we will have more detail to bring next week in conjunction with the Minister of Education. But we have been working very closely with education on developing the best guidance that we can put together. Yes, we did think about this together, and it really was education's advice and position that, given the short the early end to the year compared to other jurisdictions and the early return, it was much better to focus on a good return to classes for the fall. So that's really been our focus on working together on how we would make that happen. And this is also it really gives us a chance to learn from the practices in other jurisdictions, particularly Quebec and BC, and really learn from their experience, as well as the jurisdictional guidance that is being put together across the country.
Thank you. Follow up, Tim?
No, I don't actually.
Okay. So we're going to try to move to the phone lines, see if it works. Chris, CBC?
Hi, I'm here.
Great. Your question, please.
Okay. My first question is for Dr. Hanley. On Friday, and I guess today, you sort of spoke about reopening in terms of risk. That this necessarily involves risk. I guess, have you given any thought to what is the likelihood that we will see new cases of COVID in the Yukon as a result of taking these risks?
Yeah, it's a really good question. I think it is likely that we'll see more cases, but of course that is the risk that we want to mitigate as low a point as possible. So it would, if I were to ballpark likelihood, we're clearly in a better, even when we look, and again, this is all around risk of importation, and if we look at say risk of importation from BC, it's really quite low right now, and much lower than it would have been 2 months ago or 6 weeks ago. So So really, this thinking is based on risk of importation. As we work with Public Health Agency and develop some modeling, we actually hope to have reasonable numbers to help us estimate that. But it's really going to be based on what's going on in the other provinces, match that with how many people are we expecting in, how will that increase based on at least gradual reopening, and kind of just be able to maintain ourselves in a position that we're confident enough that if we had cases or clusters, we've shown we can handle them, and we would continue to be confident that we can handle cases like that. If you put a bunch of combinations together, importing cases from where we see cases beginning to rise again in the provinces. Let's say we hit fall, and we see with flu season, we see more cases. Or, we have simultaneous outbreaks, we have other things that affect our hospital capacity. It's really that package of considerations that will bring us back to reconsider whether we can still afford to do this. But I do think I think part of this trade-off is being comfortable with that, allowing that there is a greater risk than we have now with shut borders of bringing in COVID, thus the need to bring it back to, if a case were introduced, how should we be acting? So, as if we're taking care of high-risk places, if we're physically distancing, we're observing those measures, we're staying away from others while we're sick, then we're going to mitigate the implications of any particular importation.
Next question, Chris.
Thanks. My second question is for the Premier. Mr. Premier, you mentioned the need to not just be non-racist, but anti-racist. I wonder if you could outline some specific policy steps that your government has taken to address racism in the territory, and specifically anti-Black racism.
Yeah, so we've put money into cold case files. We've done things for anti-discrimination files. We had some great legislation that we were going to put forth in the legislature, which we will definitely be putting forth in the fall when it comes to LGBTQ2S+. And so again, this isn't necessarily the message today about all of the good things that we're working on for legislative purposes or as a government. When we spoke about COVID, we talked about government things that we do, and also the fact that it's the things that Yukoners do that really made us safe as well. And I think that that's just the message here today as well. As a government, we will continue to work on legislation and practices and policies to continue to move forward to a less discriminatory society. My message today is for every individual Yukoner to think about their own lives and think about their own, what they can do as individuals, not only to just be anti-racist themselves, but also to stand up against it. Now more than ever, I am hearing from people on the street how proud they are to be Yukoners and how thankful they are to live here. And I think we need to look at that in the context of how welcoming we are to our own neighbors. We have lots of issues that we want to deal with here on reconciliation. We have lots of issues that we want to deal with on cold cases, on discriminatory practices in the past, and we'll continue to do that as we move forward. I just wanted to take some time today to reach out to Yukoners again, because we are the best suited to continue that conversation as individuals and to stand up for racism when we see it.
Thank you. We'll move to Claudiane, Radio-Canada.
Oui, merci. Donc, dans un premier temps, pour le docteur Hanley, c'est possible de me répéter un peu la question là, que mon collègue vous a posée, à savoir, est-ce qu'on s'attend à un retour de nombre de cas? Si oui, quel risque est acceptable? Combien de cas? Et comment est-ce qu'on évalue la réponse, là, la prise en charge de ces cas-là?
So the question is for Dr. Hanley. Can you please repeat in French what consideration you'll have in mind if you see an increase of cases with the opening of the border? What will you consider important, and what kind of measure can we expect if things like that were to happen?
Oui, pour le moment, c'est de concentrer sur de minimiser le risque d'importation, mais en même temps d'accepter qu'il y aura un risque quand même qui vient avec une ouverture de frontières. Donc, c'est de gagner peut-être un nouveau mesure de tolérer un certain risque parce qu'on sait qu'on ne peut pas continuer avec les mêmes restrictions qu'on a en place à ce moment. Pour déterminer la réussite de cette tolérance, donc si on continue d'avoir des cas comme on a déjà vu, comme les 11 cas qu'on a, qui viennent de temps en temps, ou même avec des petites éclosions, on reste confiant qu'on peut gérer ces cas ou ces éclosions. Donc, on a une mesure, une confiance sur la capacité de santé publique. Au même temps, on continue de suivre tous les autres indices. Par exemple, le niveau de l'épidémiologie, le niveau des cas dans les provinces, surtout Colombie-Britannique pour cette première étape, mais aussi la capacité de santé aiguë, comme l'hôpital, le nombre de lits, le nombre de lits dans les soins intensifs, les niveaux d'équipement personnel et puis la présence d'autres éclosions, d'autres maladies, par exemple, qui peuvent toucher sur la capacité publique ou la capacité de soins aigus. Et puis, donc, le nombre des individuels qui viennent, si on réussit d'avoir les indices basés sur les modèles pour faire une prédiction de futur. Donc, toutes ces mesures qui conviennent comme un package pour continuer d'évaluer notre confort avec les mesures qu'on a. Toujours avec le risque de fermer encore ou de faire plus de restrictions si tout est indiqué par les mesures en place.
Avez-vous une autre question, Claudiane?
Oui, j'ai une autre question pour le Premier ministre. I'll ask in English. Part of my question to Dr. Hanley, though, was how many cases would be acceptable? Second question for the Premier is, could Yukon make an exemption for Alaska? What would it take to be able to open up to Skagway and Haines?
Good question, Claudiane. You know, what we can do is, and what we've been asked to do from the federal perspective as the premiers meet with the Prime Minister and the Deputy Prime Minister on a weekly basis, is to bring forward the concerns and issues of the states in which we share borders with, and that process of sharing the information and the conversations that we've had with the governors of the states that we share borders with on a federal level will help shape policy from a national perspective. I know that I've received letters from concerned Yukoners who have family members, even partners that live in Skagway or in different areas, and they haven't seen their loved ones in a long time. And I know that this is a question on a national level, whether or not we would go towards something that would consider families, and it's something that the federal government would have to consider because, of course, the jurisdiction would be under their purview. It would be great, wouldn't it be great to be able to go down to Dai for the weekend and go camping or to visit our good friends? It's the one thing about being in this job. We have an opportunity to make great friends with the mayor and council, for example, in Skagway. Skagway, and you know, it'd be great to be able to go down and to have those conversations with these communities that are very close to us. But that's a decision that would have to be made on a national level, and for all intents and purposes, or for all what we see from the federal dialogue, I don't think we're going to see one-offs for particular communities. I think it would be a national consideration that they would be moving forward on.
Merci, Claudiane. We'll move now to Julien, Aurore-Boréal.
Non, je n'ai pas de questions, merci.
Merci, Julien. So that is it for today's COVID update. Thank you, Premier Silver. Thank you, Dr. Hanley. Thank you for everyone for your time today. The next COVID-19 update will take place on Friday, June 5th at 2 p.m.